The heart beats visibly, and the blood pressure surges with growing anxiety. Rebecca Eze was set at a private medical facility in Abuja for an open heart surgery, one of the dreaded surgeries in Nigeria. But the 100% Nigerian multidisciplinary team is fast getting used to such operation, and so no cause for worries. Eze's operation was not a first of its kind, and certainly not the last. And then the task to save one more life begins.
What we did is a mitral valve replacement. The mitral valve is faulty and is as a result of rheumatic heart disease from infection with certain kind of bacteria.
A week later, Mrs. Eze is not only fast recovering but is filled with joy of fulfillment as she appears with her husband.
I would love to live with this car, but then it's better off than living with the fear that my wife is going to collapse Sunday because of heart disease.
As the Ezes celebrate, so too was the coordinator of the facility after the success of the 5th open heart surgery there and still counting. The lead surgeon, Dr. Onyekwelu Nzewi, says nature and Western life rapidly being adapted to by many people will always necessitate open heart surgery.
Every 1% of a live birth has a congenital heart defect that will require surgical intervention. So you can imagine the number of children born in this country, the number that require something done. But more importantly, the adults now that are beginning to imbibe Western lifestyle faces ischemic heart disease, which is another category. There's an epidemic waiting to happen in Nigeria.
The number of cases grows, but not with commensurate hospitals and specialists to handle them, that thereby encouraging medical tourism.
Nigerians go abroad not because they want to go abroad, but they want the best for themselves, knowing that life does not have a duplicate. You want to put your life in the hands of people that you can trust.
Rebecca Eze's confidence in this facility and the team of surgeons was rewarded with this success story as she's got another lifeline. So, such confidence and support are being canvassed for hospitals in the country.
One of the greatest challenges of the Nigerian patients is that they don't have the money to pay for this procedure. And if you don't do plenty, you don't develop enough capacity. So we think, one, the government should be able to probably fund the national health insurance, involve more people in the health insurance so that they will be able to pay for the cost of this very expensive operation.
Only such support, they say, can sustain the operation in the country. The first open heart surgery was done in Nigeria in 1974 but stopped afterwards due to unconducive environment before another breakthrough in 2013. Perhaps this success story will encourage more Nigerians to have confidence in indigenous health facilities and save the country each sum of money spent in medical tourism every year. In Abuja, Musbal and Wahab, NT News.